what are the complications of acute pancreatitis? What are the complications of acute pancreatitis? Number one, it can lead to necrosis. And with necrosis, what are the things that will cause you to start thinking that this patient may have necrosis? Number one, if the patient starts deteriorating or has developed symptoms and signs of sepsis, then you should start thinking about infected necrosis of the pancreas. If the patient also has increased white blood cell count, or the patient starts developing very bad fevers, they start thinking about infected necrosis. Or if the patient fails to improve after 7 to 10 days of hospitalization, then you want to start thinking about, infected necrosis. Next best step, if you suspect that the patient has infected necrosis, give empiric antibiotics, okay? And if the antibiotics fail, then you want to do pancreatic debridement. Give antibiotics. If antibiotics fail, then give pancreatic debridement. Now, if you suspect gallstone pancreatitis, what's the next best step? The next best step will be to perform urgent endoscopic retrograde cholangiopancreatography and sphincterectomy for patients with cholangitis. Okay, so you've confirmed already that this patient has gallstones and it's likely what is causing the pancreatitis. What's the next best step? ERCP. So this time, because you're going there to remove the gallstone, right? And that's why we said that ERCP is only reserved for a few people. And cholecystectomy should be performed after recovery from acute pancreatitis in all operable patients with gallstone pancreatitis. So patient comes in, you realize that liver enzyme is elevated, but not elevated at the level of alcoholic liver disease. Patient has been monitored and the patient is doing well now. What should you do? Do you keep the gallbladder there so that it keeps throwing stones at the pancreas? No. So you've got to take that gallbladder out. Okay, so the complications again, acute perinephric peripancreatic fluid collection. Okay, there can be fluid collection around the pancreas. Number two, pancreatic pseudocysts, and that pseudocyst can be really big and cause a lot of tear spacing. So you want to watch out for that as well. And then there can be acute necrotic collection, and that's why we're saying, the patient is not getting well, those kinds of things. And there can also be complications with bleeding. They can bleed as well, and they can develop pseudoaneurysm, and there can be duodenal ulcer due to compression of the duodenum by enlarged pancreas. That can also lead to a duodenal ulcer. Now, there can also be splenic and portal vein thrombosis. Splenic and portal vein thrombosis. And there can also be complications like diabetes and pancreatic duct damage. So please learn these complications of pancreatitis very, 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 very well. So doctors, it's been that is what you need to know. The Ranson's criteria. Don't just learn the name Ranson. That's not what you need. Rather, you need to know the components. What am I going to do in the first 2 days for evaluation to help me to tell if this pancreatitis is going to go bad or not? And then what am I going to do after the 48 hours? Okay, learn the Ranson's criteria. Learn that gallstones are the commonest cause of pancreatitis, and then followed by alcohol use. What did you learn today? 3 things that somebody learns today.
So we have learned about the abdominal masses. And the organs that masses related to the abdomen, like gastrointestinal, and genitourinary, also vascular, and like we have learned about the abdominal masses, that the masses belong to the lymphatic system, the genitourinary system, or the gastrointestinal system, and the abdominal wall masses, how you can differentiate with the others. And we have learned about the vascular masses, like abdominal aneurysm, and we have learned about the lymphatic masses, like the splenic and the adrenal masses. And we have learned about the acute pancreatitis. and the sign and symptom of the pancreatitis, and also the diagnostic evaluation of the pancreatitis, and the complications. What are the complications? Acute complication, late complication, like the pancreatic abscess and pseudocysts. So that's why, like, we have learned about the pancreatitis, everything. Thank you for that.
Beautiful. Sure. Dr. Cosmas, your question.
Yeah, Dr. Bruni, I don't know if this is silly, but I will still ask. Initially, you said an ultrasound, abdominal ultrasound will be done in all patients with suspicion of pancreatitis to rule out gallstone. Then later you said if the etiology is unclear, we'll do endoscopic ultrasound. Are they both the same? The endoscopic ultrasound and the abdominal ultrasound, are they both the same?
No. The abdominal ultrasound is external. The endoscopic ultrasound goes in to do it.
Oh, okay. Okay. Thank you.
Sure.